name is Eliza Ashley M. Salta. So today is I will going to perform the transferring the patient from bed to chair and transferring the patient from chair to bed. So first is I will review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned. So assess for tubes, IV lines, incisions, or equipment that may alter the positioning procedure. And then identify the movement, limitations, consult patient handling algorithm, if available, to plan appropriate approach to moving the patient. Rationale of it is reviewing the medical record and plan of care validates the correct patient and correct procedure. Checking for inferring equipment helps reduce the risk for injury. Identification of limitations in ability and use of an algorithm helps to prevent injury and aids in determining best plan for patient. Next is I will perform hand hygiene and put on PPE as indicated. So the rationale of it is hand hygiene and PPE prevent the spread of microorganisms. PPE is required based on the transmission precaution. Okay. So next is I will identify the patient, explain the procedure to the patient. The patient identification validates the correct patient and correct procedure. Discussion and explanation ng procedure is nakaka-help na mag-reduce ng anxiety and ma-prepare yung patient for what to expect. So, hello po ma'am, my name is Eliza Ashley Salta, your student test for today. May I know your name po?
My name is M. Salta.
May I know your birthday po?
July 16, 2008.
May I check your ID band po for verification lang? Okay, thank you po. So this procedure po is I will going to transfer you from bed to chair. Is that okay with you po? Okay po, thank you. And then next is if needed, move equipment to make room for the chair. Close the curtain around the bed and close the door to the room if possible. So a clear pathway from the bed to the chair facilitates the transfer. Closing the door or curtain provides for privacy. Next is, I will place the bed in the lowest position and raise the head of the bed to a sitting position or as high as the patient can tolerate. So the rationale of this is proper bed height and positioning facilitates the transfer. The amount of energy needed to move from a sitting position or elevated position to a sitting position is decreased. So assume that I already placed the bed in the lowest position and raise the head of the bed in a sitting position. And then next is, I make sure that the bed brakes are locked. I will put the chair next to the bed if available, lock the brakes of the chair. If the chair does not have brakes, brace the chair against a secure object. So the rationale of this is locking brakes or bracing the chair prevents movement during transfer and increases stability and patient safety. So assume that already locked the bed brakes, and next is I will put an object to the chair for it to prevent from moving. Next is I will encourage the patient to make use of a stand assist aid, either freestanding or attached to the side of the bed if available, to move to the side of the bed and to a side lying position, facing the side of the bed on which the patient will sit. The rationale of this is encourage independence, reduces strain for staff, and decrease risk for patient injury. So assume that already encourage the patient to make use of a stand assist aid. I will lower the side rail if necessary and stand near the patient's hip. Stand with your legs shoulder width apart with one foot near the head of the bed, slightly in front of the other foot. So the rationale of this is the nurse center of gravity is placed near the patient's greatest weight to assess the patient to a sitting position safely. So assume that I already lowered the side rail. Encourage the patient to make use of the stand assist device, assist the patient to sit up on the side of the bed, ask the patient to swing his or her legs over the side of the bed. At the same time, pivot on your back leg to lift a patient's trunk and shoulders. Keep your back straight and avoid twisting. So the gravity lowers the patient's legs over the bed. The nurse transfers weight in the direction of motion and protects his or her back from injury. So I will now stand in front of the patient and assess for any balance problems or complaints of dizziness. Allow the patient's leg to dangle a few minutes before continuing. So the rationale of this is standing in front of the patient prevents falls or injuries from orthostatic hypotension. And the sitting position facilitates transfer to the chair and allows the circulatory system to adjust to a change in position. So may napipil po ba kayong any dizziness? Wala naman po. Okay po. We'll assist the patient to put on a robe as necessary and non-skid footwear. So the rationale of this is robe provides warmth and privacy. Non-skid soles reduces the risk for falling. So assume that already provided a robe to the patient and a non-skid soles Now, I will wrap the gait belt around the patient's waist based on assessed need and facility policy. So the rationale of this is gait belts improve the caregiver's grasp, reducing the risk for musculoskeletal injuries to the staff and the patient. It provides firmer grasp for the caregiver if the patient should lose his or her balance. So, ilalagay ko na po yung gait belt. So I will now stand facing the patient, and I will spread my feet about the shoulder width apart and flex my hips and my knees. So the rationale of this is this position provides stability and allows for a smooth movement using the legs' large muscle groups. So now is I will ask the patient to slide his or her buttocks to the edge of the bed until the feet touch the floor. I will position myself as close as possible to the patient with my foot positioned on the outside of the patient's foot. If a second staff person is assisting or if available, have him or her assume a similar position. So the rationale of this is doing so provide balance and support. Pwede pong palagay yung buttocks to the side of the bed. Okay na po. Next is I will encourage the patient to make use of the stand assist device if necessary. Have second staff person grasp the gait belt on opposite side. Using the gait belt, assist the patient to stand, rock back and forth while counting to 3. On the count of 3, use the legs, not my back, to help raise the patient to a standing position. If indicated, I will raise my front knee against the patient's weak extremity as he or she stands. Assess the patient's balance and leg strength. If the patient is weak or unsteady, I will return the patient to the bed. Holding at the gait belt prevents injury to the patient. Raising my knee against a weak extremity prevents a weak knee from buckling and the patient from falling. Assisting balance and strength that helps to identify the need for additional assistance to prevent falling. 1, 2, 3. So next is I will pivot on my back foot and assist the patient to turn until the patient feels the chair against his or her legs. So the rationale of this is this action ensures proper positioning before sitting. So next is I will ask the patient to use an arm to steady him or herself on the arm of the chair while slowly lowering to a sitting position. Continue to raise the patient's knees with with my knees and hold the gait belt. I will now flex my hips and knees while helping the patient sit in the chair. So the rationale of this is the patient use his or her own arm for support and stability. Flexing the hips and knees uses major muscles groups to aid in movement and reduce strain from the nurse's back. So now is I will assess the patient's alignment in the chair. I will remove the gait belt if desired by the patient, depending on the patient's comfort if could be left in place to use when returning to bed. I will now cover with a blanket if needed. Make sure a call bell and other necessary items are within any reach. So the rationale for this assessment promotes comfort, blanket provides warmth and privacy, and having a call bell readily available helps promote safety. Okay na po ba kayo sa position sa chair? Tatanggalin ko na po ba yung gait belt? Okay po. Forward po ha. And assume that I already placed a call bell beside the patient. So I will now clean transfer aids for facility policy if not indicated for single patient use. And then I will now remove my gloves and any other PPE if used, and I will now perform hand hygiene. So the rationale for this is proper cleaning of equipment between patient and use prevent the spread of microorganisms. Removing the PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene prevents the spread of microorganisms. So I will now remove my gloves. So now is I will now transfer the patient from chair to bed. So, hello po ma'am, my name is Eliza Ashley Salter, student nurse for today. May I know your name po?
Brandon is Ansata.
Your birthday po?
July 16, 2017.
May I check your ID band po for verification lang po? Okay, thank you po. So, today po is, yung procedure na gagawin po natin is, transfer ko na po kayo from chair to bed. Is that okay with you po? Okay po. So first is tatanggalin ko muna po yung blanket sa inyo. And then now is I will place the gait belt to the patient. So now I will position myself and count 1 to 3 before I lift the patient using the gait belt. 1, 2, 3. So tatanggalin ko na po yung gate belt. Is that okay po? Press ko po kayo na humiga po sa bed. So after that po is I will now remove my gloves and other PPE and I will now perform hand hygiene.